So I wanted to make this particular video because of a conversation I had with a friend of mine the other day, and we were talking about health insurance. So I worked for a very reputable company for a very long time, 11 consecutive years, and I had health insurance coverage with United Healthcare through that employer service plan, and it was the highest tier plan that I had that was like 90% coverage, and the annual deductible, which covered me and my husband and my 3 kids, was like $350 for the entire year. So after that, then they would cover at a rate of 90%. And then, whenever you go and you need some kind of specialist service or any kind of anything, they'll say to you, oh, well, because of your insurance, it would have been this, but now it's this, and you saved this. And there's all this chat, which is meaningless. Like, all you want to know is what is the actual cost today, right? So what I realized is, after leaving this company and not having health insurance, is, first of all, if I had not had health insurance for a significant number of the years that I was with them, I would have had an extra 100 grand in my pocket and I could have bought another house, right? First of all. Second of all, when I had the health insurance and I would go to a CVS or a Walgreens to get a prescription for something that had been prescribed to me, it could have been like vitamin D, right? Because I got a vitamin D deficiency, or it could have been the B12. And they would say to me, okay, well, because of your insurance, you have the best insurance, your prescription is only $15 today. It's a set $15 that you're going to pay for your prescription today, right? And I'm like, okay. Then when I didn't have insurance and I just got a Good RX card that you can pick up, this little Good RX card at any pharmacy, and you just register your email and your phone number and all that stuff, and you use the Good RX card, that same prescription was $4 self-pay. $4 self-pay. When I went and I did specialist visits, like if you need a mammogram or whatever, in the end, if you look at your deductible, your out of pocket, and how much you're paying per month, yeah, it's actually more expensive to have health insurance than it is to just do self-pay and go have that one type of treatment or visit that you need. Right, so there was a time period where I had all these like abdominal issues, and it was obviously from the food that was eating at that time, and I did previous videos about this. So I went and I got a CT scan, I got an endoscopy and a colonoscopy, and I just went to my GP, and I got a referral for these different things, and I took that referral to whichever clinic or medical facility had the treatment. And when I went, I think I did the endoscopy and the colonoscopy, and I think it was like $960, and that was 3 years ago, and that was self-pay out of pocket. But a friend of mine was talking to me about how it was going to cost her some $4,000 to do it with her insurance, and I was like, well, why don't you check and see how much it is self-pay, and don't even mention that you have insurance? Because this is what it is it's just a huge scam. It's just a money-making scam, right, that doesn't benefit anybody except for these insurance companies. So, for those of you who are going through a similar type of situation, maybe try and see, what the cost self-pay is, because these facilities and these people, they know that if it's self-pay, people are not going to have thousands and thousands of dollars to spend. So there's no way that they can charge those crazy prices when you have health insurance, right? And they can shaft you like that. So I would test it out and see, and if I happen to be incorrect, then so be it, because you could be in a different state, or you could be in a different location or a different facility or whatever it is. But that's the experience that I had. I found that it was actually cheaper to just self-pay than it was to have your monthly premium that you're paying, your annual deductible, your co-insurance, your copay, and all this, right? It was just all a bunch of unnecessary money wasted, quite frankly. And even now, I only go to see the doctor probably once a year, just for an annual checkup, because I'm anemic, and to make sure that I'm still, getting my prescriptions for my B12 and whatnot, because I need those. And even my kids are not going to the doctors more than once a year to get their annual immunizations and the stuff that they need for the school. But other than that, they're not even sick. Nothing that, like, some Tylenol, some Motrin can't fix. Because there's organized meal planning. We're not feeding them things that they shouldn't be eating. We're not exposing them to situations or places where they're likely to get sick. And there's a level of cleanliness that is like top notch. So if you're having these kinds of issues too, I would investigate the self-pay route and see what things look like without mentioning about the insurance, and see whether you really actually need it, because it's just a huge money-making scam in the United States as far as I'm concerned, and I will not be partaking.